Hello, my name is Karen, and I'm a student physical therapist assistant from Jefferson State Community College. Today, I'm going to be talking about the disease called diverticulitis. Diverticulitis is an inflammation of the diverticulum, which is the wall of the large intestine. When it becomes inflamed, then pouches begin to form, and this is due to a buildup of abdominal pressure caused by foods moving too slowly throughout the bowel. The pouch is created by the pressure from the food and stool and that become trapped, and this is what causes the pain and the swelling and creates a disturbance within the gastrointestinal tract and the bowels. Diverticulitis usually affects all ages and genders. It's not age or gender specific. It can affect ages and genders from 19 years old to 80 years old, but it's more common usually in 50-year-olds. Common ways to identify are by using blood samples or stool samples. So when doctor visits are made, they usually take blood samples, stool samples, and even ultrasounds, x-rays, and CT scans are often used when they're searching to find out if it is diverticulitis. Another way, just signs and symptoms of diverticulitis that are common, just intra-abdominal pressure, fever, just abdominal pain, nausea, constipation is one. So medical treatments include pain medication. This pain medication is typically given, prescribed at your local, like CVS, Rite Aid, that drugstore, and it's usually oral, taken orally, and that is used to address the abdominal pain and bloating and swelling. Or antibiotics are also given specifically to fight off the infection itself. If there's no change in status after the medication is administered, then surgical options are considered. The two most common types of surgery for diverticulitis is where the diseased part of the large intestine is completely removed, or the healthy part of the large intestine is brought to the abdominal surface, and it's open and it creates a stoma. And I'll show you a picture of a stoma now that I have for you guys. So this right here is a stoma. It's the healthy part of a large intestine, and it is brought to the abdominal surface of the lady. And that's typically the most common way that surgeons go about the disease process. Let's see. So, in therapy, between the two surgeries, depending on which surgery is performed, that depends on whether or not the therapist has certain criteria to follow. So, if the patient requires the surgery where the intestine is brought to the abdominal surface, then the patient is going to have a bag. And the therapist will have to plan a treatment based on the bag that will be placed on the surface of the abdominal area around the stoma. And I also have a picture of what the bag looks like for you guys. So there you can see the stoma, and there's like a little hole that's cut out into the bag that fits properly over the size of the stoma. And that's where all of the waste can drain. So like I was saying, with that type of surgery, therapists have to plan treatments based on the bag, because it's going to be brought to the abdominal surface. And a precaution for therapy during treatment will be sure to avoid any exercises that cause the patient to move the abdominal area excessively, or any exercise that creates additional pain. So the patients are already in pain, they're bloated, they're inflamed, and they're having intra-abdominal pressure already, so we want to prevent any further pain. Another way that this could affect therapy, is the tape that holds the bag in place around the stoma can affect the skin. So proper skin management would be a part of the therapist's responsibility to make sure that the skin is maintained properly. So we want to educate our patients on proper skin management so that the area does not continue to be infected. And that is caused by leakage of the bag, the acidic waste. It pretty much eats up the skin. So it's very important to give patient education on skin and also proper ways to monitor the bag. A contraindication for therapy with these type of surgeries, specifically with the bag, would be to ensure that the bag is not removed during therapy ever, or to make sure that the bag is properly adjusted and fit and sealed, because this could cause a huge mess in therapy because the waste is what the bag is carrying. So if it is ever dislocated from the body, then it's going to cause a huge mess. And also it's going to affect the skin because of the acidic waste. So some functional limitations with diverticulitis would include bed mobility or general weakness, and these are mainly what comes after the surgery. Other than just pain would be another functional limitation as well, because it can cause the patient to withhold during the treatment. Your general medical prognosis for patients that experience diverticulitis usually have a positive outcome, because with proper interventions and therapy, patients can easily recover from this disease and regain strength. Just a tip, the best way to prevent from developing this disease is to exercise properly as well as have a clean diet. So if you guys have any questions, please post below on the discussion board, and thank you for watching.